4th of July, we've had 4 deaths over the weekend. I'm always hesitant a little bit about the weekends because sometimes we get a little bit of late reporting and everything, especially over a holiday weekend, but it's still optimistic, and I hate like crazy for these folks. We now have 2,901 deaths in West Virginia, and it's tragic beyond belief. But please join Kathy and I in our prayers and thoughts about these folks, and please just don't ever let them become a number. I mean, I can't be more emphatic than just that. But the 2,898th death was an 83-year-old male from Mercer County. The 2,899th death, an 83-year-old male from Wyoming County. Our 2,900th death in West Virginia is a 72-year-old female from Kanawha County. And our 2,901st death is a 93-year-old male from Mercer County. Again, I ask for their prayers and I ask for you to, if you know these folks and everything, to reach out to the families and everything. Don't let them feel like they're alone. I mean, it's just a terrible, tragic time, that we've come through, and we're on our way to healing and coming back to as close to normalcy as we possibly can. But at the same time, it's a really sad time for these folks. So remember that and keep them in your prayers. We had 130 new cases in the last since our last update, and our positivity rate is 1.14 for the daily positivity. Our cumulative positivity is 5.00. I'll be so happy when we really pull that down below 5%. Our active cases are 1,093. Our recovered cases a little over 160,000. We have only 66 people, but that's 66 people that are hospitalized in West Virginia, and 25 in the ICU units. We have no red counties, no orange county, no gold counties, and 2 yellow counties, and they're shown on our map right there. Again, if you're 65 and older, and we've got updates as far as the vaccinations of our 65 and olders, and it's unbelievable how good we've done there. But the only way we've gotten there is we've all pulled the rope. We've all kept pushing these folks and pushing them to get there and everything. What they've done is unbelievable, unflat believable. The vaccination rate on our 65 and older, or our 50 and older. And so, but I still, cast this out to anybody that's 65 and older, especially all those that still are out there that haven't been vaccinated. I urge you to go get vaccinated. I mean, it's so simple and it's so safe, it's unbelievable. And truly, if this terrible killer gets on you, it probably won't turn you loose. And so it's a tragic way to die. You can't breathe, and it's just really, really, really tough. If you have any symptom at all, please go get a test. The faster we know, if you happen to be positive and everything, the faster we can get rid of this thing. The antibodies are there for you, and the antibodies will get rid of it. The vaccine eligibility, 12 and above, I tell you over and over that it is extremely important that you get your second shot if you're Pfizer or Moderna, and the effectiveness of these vaccines is off the chart good. It is unbelievable how good they are, and how really few side effects that there is, and it's just amazing how it is truly a blessing from God that we've been delivered this vaccine. Again, I need help with the young people. The young people out there are the ones that are dragging their feet. The sun's shining, they're out of school, all's good in the world and everything, and yet they don't really realize that they could be the transmitters that could be passing us on to someone that's going to die. And so, absolutely, those folks that are 12 to 35 years of age, I need the parents and the grandparents and everything to push them and urge them to go get vaccinated. And as far as our sweepstakes, the Do It for Baby Dog sweepstakes, Baby Dog has gotten to be awfully popular, and she's a face that makes people smile. And on top of all that and everything, she loves everybody. I don't know how it could be any better than that right there, and that right there is telling us all, and gives us a feeling of warmth and everything in lots of ways and everything. So our third lottery drawing is going to be held tomorrow on Wednesday, July the 7th. We're going to give away another $1 million on that day and 2 new custom trucks and all the different getaways, the 25 getaways and a lifetime hunting and fishing license and hunting rifles and hunting shotguns. And really importantly, 2 more full-time, full ride scholarships to all of our public institutions, to anyone that they select. And it's room and board, it's tuition, books, it's everything. And so what a deal, that would change the lives of a couple young people, and that'll be wonderful. And our last drawing is going to be for $1,588,000. And the second place drawing is going to be for $588,000. That'll be the last one that we do. And I remind everybody, Nathan's saying, save a life, change your life. And there's right now 333,000 West Virginians that have registered for this drawing. All you've got to do is register. It takes 1 minute to do so. And if you've been vaccinated, all you've got to do is register. But the whole key is this drawing is for people that have been vaccinated. I say it over and over. For those folks that haven't been vaccinated, they're in a lottery too. I just read 4 names right here just a second ago and everything of folks that we've lost. They're in a lottery on whose name's going to be called, because those people that haven't been vaccinated, over 99% of the new cases of COVID or the new variant of Delta, over 99% of those people that have COVID or get COVID or get the Delta variant, over 99% of those are folks that haven't been vaccinated. It's absolutely, there's no sense in the world to not getting vaccinated. It's a tremendous risk. You need to really think about that. We now stand, let me get all this straight. Okay, on our vaccine distribution update, we have hit a huge milestone. We have now vaccinated over 1 million West Virginians with at least one COVID-19 vaccine. I congratulate everyone who's played a role in getting us this point, but we still have more work to do with our residents as far as getting them vaccinated. We're at 87.6% total administration rate. We're at 77.4% of West Virginia residents that are over the age of 65 that have have both doses. And I get this is unbelievable. We're at 87.3% of all West Virginia residents that are 65 and above, 87.3%, and we are now going to change our goal again. There's a thing, in athletics, you continue to raise your bar. Well, we hoped like crazy we could get to 70% of our 65 and older. Then all of a sudden we thought, well, 75 is attainable, and then 80, and then 85. 85 was even attainable. Unbelievable. Nobody could even think that could be possible. And now we're at 87.6%. We're at 87.3%. And we're going to raise this goal for 65-year-olds, for 65 and older. We're going to raise our goal to 90%. 90% of our 65 year of age and older. And we're going to also raise our goal on those folks that are 50 and older to 85%. It's just unbelievable. It's totally unbelievable. We're at 79.4% of the 50 and olders right now. You remember way back when we said we were hopeful to get to 65% of our 12 and older. The total eligible folks. We're at 64.5 right now. We're going to get there, and we're going to surpass it. Absolutely, it's tough. And you may have a whole lot of people on the outside that are throwing mud at you and saying, well, why in the world? Because it's not going great. It's not going great and everything, so why do this? Well, if they'll just step back and say just this. We have 87.3% of the people that are absolutely dying. 65 and older, 87.3% of those folks. For the people that are dying, we have 79.4% of the 50 and olders. Now, you know what I'd say? I'd say West Virginia, the third highest state in the country as far as elderly, and West Virginia with the most chronic illnesses, and West Virginia with no ocean around it to protect it, and West Virginia with a death toll compared to our neighbors that is really outstanding. West Virginia, the most vulnerable state in the country, absolutely has come up with numbers that are unbelievable. 65 and older, 87.3% today. 50 and older, 79.4%. It didn't take a rocket scientist to figure out really and truly at the end of the day who was dying. It was the people that were 50 and older, the people that were 65 and older. That's the people that were dying. Now, I wish like crazy we could get more 12 to 35-year-olds there, sure, and we're trying. But really and truly, if you'd have told me West Virginia is going to have 87.3% of the 65-year-olds and older and 79.4% of the 50 and older and absolutely lead the nation in the vaccine rollout, lead the nation in what we did in getting our nursing homes, vaccinated first, and lead the nation over and over and over, you know what I would say to you? I would say, kiss my butt. Anybody that would sit and think in any way that West Virginia is having trouble now getting 12 to 35-year-olds there. Well, first of all, for the most part, those people aren't at danger like the fact that our older people have been. West Virginia, you've done a whale of a job. And it's not me, it's not all these medical experts and everything, it's all of us together pulling the rope. You've done a whale of a job, West Virginia, and you just be proud of yourself. People want to beat you down all the time, but don't drop your head. You be proud of yourself, West Virginia. You are the diamond in the rough that everybody missed, and everybody's getting to know that now. Be proud of your pond. Be that frog that's proud of your pond. From the standpoint of our manufacturing or business and church outreach and everything, we ask anyone to call us. We'll come vaccinate your folks, vaccinate your employees, your congregation. All the stuff on our vaccine info line is up. All of our free testing about. We continue to thank Walgreens and Fruith for all that they've done and everything, and take advantage of that free testing. We have 5 outbreaks in our long-term care facilities. We want that to be 0. We have 0 in our churches. We have 2 inmates that now have COVID, and we have 6 staff cases and everything. And I mean, it's outstanding all across the board. Just keep doing that great work, West Virginia. We absolutely ask you if you would just consider giving blood, giving plasma. It is so important. It is off the chart, especially if you've had this dreaded killer and survived it. You ought to at least think about the possibility of giving blood or plasma. We have new pricings that have gone out through the DNR in regard to our lifetime hunting and fishing license. And I'm going to read through this and everything because I'm tickled to death about this and everything because, listen, the more and more kids especially that we can get out and they can enjoy the outdoors and it touched their soul, and infect them like I was at an early age, and it just is so meaningful. And so let me just tell you that this program was made possible by a bill that was passed by the 2021 legislature, and I absolutely thank them so much. I signed the bill very proudly, and this program provides for just this: 60% off a lifetime license purchased before the child's first birthday, 45% off the license purchased before the child's 5th birthday, 25% off for any child that's purchased before their 10th birthday, and 10% off up to the 15th birthday. The regular price is $805, and before the first birthday it's $322, and then it goes $442, and then $603, and then $724. It's a great, great bargain. It will spark a lifetime love of the outdoors and create so many memories and everything. Our kids have so many pressures today. You know, I'm a coach and I'm with the kids and I see so many pressures and everything. But I'm going to tell you this: you talk about doing something for a child that absolutely will help that child in so many ways as they go forward in life. Get them out in the woods and get them to our streams and let them enjoy something that is so special it's off the chart. You know, I say it all the time. Fortunately, through my life, I've had enough monies and everything, and I could have done a lot of things. I could have gone to Argentina and trout fished, and I could have gone to wherever on a big hunting trip, all across the world. I didn't go. And the reason I didn't go, I never left this country to do that. And the reason I didn't go is not because it wasn't great, and I don't begrudge people that do that and everything, but there is nothing better than here. There's just plain nothing better. You know, and from time to time I'd go to Wyoming trout fishing, but beyond that, that's about all I've ever done. It's just here. But if you stomp up and down a few of these mountains and you wade and go up and down a few of these streams and slip on a rock and fall in from time to time and everything, it is unbelievable. It's just truly spectacular what this state's all about. So take me up on that, please. You can't do anything for a kid any better than that in my book. Now, I have a tragedy to report and everything, and this happened on Stonewall Jackson Lake and everything. We lost a beautiful 29-year-old girl, Sarah Hutchinson, and she hit a wall, while on her tube, I think that's what happened, and there was a couple of other women that were injured, and they were flown to Ruby, and after suffering some serious injuries as well. I ask, I really thank God above that our DNR patrols were on the lake and were able to quickly respond to this scene, but when it really boils right down to it, if you go out on any lake and you see all the boats, flying around and everything, people on Sea-Doos or whatever it may be, and there's people just out enjoying the day and having a lot of fun and everything, but at the same time, there's a lot of congestion and a lot of traffic, and so you just got to be really careful. Really watch what you're doing, from the standpoint of please don't be out driving a boat and be under the influence of alcohol or drugs, and you just got to be really careful. I mean, this is a terrible, terrible tragedy, and you got to remember always to wear your life vest and just watch what you're doing, because it's not a place you can drop your guard and completely relax and everything. It's a place you can go have a lot of fun and everything, and enjoy the day and enjoy your family, enjoy all your friends and everything, but you just got to be careful. That's a terrible tragedy. Terrible, terrible, terrible. I've got an appointment to tell you about at the Human Rights Commission and everything, and this is a wonderful woman right here, but Tia Welch of Charleston, we have appointed her as the executive director of the West Virginia Human Rights Commission, an agency under the West Virginia Health and Human Resources. But this appointment takes place effective immediately, and this lady's done lots of stuff, and a lot of people know her and everything really well, and I know she'll do a fabulous job, and we congratulate her, and we're blessed to have her. That's all there is to it. But thank you so much. And Tia, I know you'll do fabulous. That's all there is to it. But But anyway, thank you so much, all of you. That's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. Just to really reinforce a couple of things that the governor said, we are seeing the Delta variant of COVID-19 start to spread in some states in the U.S. The Delta variant is the most widely expressed in the state of Missouri, where they've seen about a 35% increase in hospitalizations in their state over the July 4th holiday weekend. And we're also seeing it in several other states. Now in West Virginia, we have only 12 cases that we've been able to document so far. So we are not seeing explosive growth of this variant yet. But as we have seen throughout this pandemic, West Virginia is always a little bit slower to see some of the things that we see spreading from the rest of the world and from other states. And so we know that it's coming in West Virginia as well. And as the governor said, we are seeing around the country as well as around the world that people that are getting sick with any of the COVID-19 viral variants, but particularly the Delta variant, are the people that have not been fully vaccinated, either have not had any vaccines, which we see in Los Angeles, where in certain African American communities with really low vaccination rates, there is a substantial increase in hospitalizations. And as we know, as the governor said, for West Virginia and our country, that not being vaccinated is very, very risky, not only for you getting sick, but also you transmitting the virus to other susceptible people. A recent study was out that said that people that had gotten sick with COVID-19, about a quarter of people from 18 to 35 had persistent symptoms weeks after recovering from the acute viral infection. People 35 to 50 had about a third of those people had symptoms persistent for several weeks after, and people over 50, almost half of them had persistent symptoms weeks after the acute viral illness. So we know that long COVID is also a risk. So it's really important, although we're really proud of the vaccine rates that we've seen in West Virginia among our older West Virginian residents and citizens, we need to make sure that we are also helping younger people understand that it's not just a benign illness. This Delta variant is much worse. And that we know that as many people around the world are not immunized effectively because they don't have access to the vaccines, that more variants will likely come. So the way that we protect ourselves and protect West Virginia is all of us being vaccinated, and we have vaccines. We really, really hope that people take advantage of this and also understand that this pandemic, although we're very, very fortunate to have the vaccines, and we're so happy that the West Virginians that have already taken the vaccines are vaccinated, that really we need people to be fully vaccinated. That's 2 shots of the mRNA vaccine, the Pfizer, Moderna, or 1 shot of the Johnson & Johnson, and being 2 weeks afterwards to be fully immunized. And in Israel, which is a country that's had the most immunizations, what they found with the Delta variant, that about 64 to 68% of people were protected against getting infected, even fully vaccinated, but that 93 to 96% protection from serious disease, hospitalization, or death. So this variant is trickier, and we need to make sure that as many West Virginians as hear this call, please start your vaccine series if you haven't yet. We need you to be fully vaccinated. Very important. The Delta variant is a very different strain of COVID-19, and it's one that if you're not vaccinated can cause really serious problems. So thank you.
Thank you, Dr. Marsh. Dr. Ayn Amjad, Secretary Bill Crouch, and Retired Major General Jim Hoyer are all joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media.
Good morning, everyone. Good morning, Governor. Actually, it's good afternoon. 12:03. Let's pursue this Delta variant a little bit more. We've had 12 cases now for a full week. We haven't seen any increase. Are you concerned that we may see a backlash like we're seeing in some other states, may see a spike? And what are we doing beyond just literally begging people to get vaccinated to try and stop the variants? And how are the people who have the variants now being treated, and how are they doing and responding to treatment?
Well, Mark, I'll defer to Dr. Marsh on this in just one second, but Mark, just hear me out just 1 second on this. From the standpoint of this variant, I mean, I don't know how in the world we can make it any clearer. You've got Dr. Marsh who's telling people that this variant is more infectious, and it's more dangerous, and it's more deadly, and there's more side effects, and there's more and more and more. Now, Mark, just remember this, and please, everyone should never forget this. I'll never forget being on your show with Dr. Marsh and stepping out of the show, and we got news right then that we went from 2 cases to 4. And he looked right at me and he said, "Here it goes. It's going right now." And I thought, over 2 to 4? And what happened? It took off like wildfire. From the standpoint of we've only got 12 cases of the Delta variant in the state of West Virginia, I don't know. I don't know what will happen. But I know what happened when we went from 2 to 4. Doesn't sound like much, Mark. It sounds like we haven't had any increase in Delta cases and everything. And so really and truly, we're okay. Don't buy into that. Dr. Marsh, take it from there, sir.
Thank you, Governor, and thank you, Mark. The governor is absolutely correct. We know that the Delta variant is in West Virginia, and even though we haven't been able to document using our genetic sequencing more positive cases, we do know that this variant is very likely spreading in our state, like it is in every state. And as the governor pointed out, we know that this variant has a very much worse set of characteristics related to how it spreads. Remember, we talked about the R naught values of the base virus being 2.3 to 2.7. This variant is 5 to 8. And that means for every 1 person infected, they infect 5 to 8 more people. So although we haven't seen explosive growth in West Virginia yet, a DNA sequencing company nationally believes that about 40% of the new cases of COVID-19 are actually being caused by the Delta variant. And we know that it's just a matter of time until we'll see West Virginia go from being almost all the United Kingdom variant that we're seeing today to almost all the Delta variant that we will absolutely, I think without any question, see in the future. We know that this variant infects people and causes very severe disease, 2.6 times as likely to cause hospitalizations as the UK variant in unvaccinated people, and also more severe in partially vaccinated people. So this is absolutely the time to act right now instead of waiting till the whole house is on fire before we start to do the preventive work. So it's really important, Mark, as the governor has said many times, and we have tried to also reinforce in that this virus is different. This virus is more deadly. It infects more rapidly. It infects younger people. It can cause younger people to get sicker. So it is the time right now for all West Virginians to get vaccinated. Thank you.
All right, thank you, Mark. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. I just wanted to follow up on Mark's question and continue along the same vein. Dr. Marsh, could you weigh in on what this means for mask wearing? I've seen some conflicting information out there. Some places saying we should put the masks back on again. Others saying it's not necessary. Where do we stand in terms of masks?
Governor, you're okay.
No, please, go ahead.
Oh, thank you. the CDC is still very solid in that in people that have been fully vaccinated and are 2 weeks after their last dose, then they should feel okay not wearing a mask. In people who have an immunocompromised state or who are concerned, who may be elderly, who may have additional risk factors, if they feel uncomfortable, particularly indoors or in crowds, then it's absolutely appropriate, even if they're fully vaccinated, that they should feel very comfortable to wear a mask. And younger West Virginians and younger citizens of our country below 12 years old who right now are not eligible for vaccination, the CDC is now starting to support this concept that wearing masks, particularly indoors, particularly in crowded areas indoors, is a reasonable thing to do because this variant is more infectious for younger people. And it's been shown now that people as young as 10 years old can spread this variant. And in a camp in Georgia, people 6 to 10 years particularly right now.
All right, thank you, Charles. We apologize for that brief technical delay. Next, we'll go to Taylor Stuck with the Huntington Herald-Dispatch.
Hi, Governor. Hi, Governor. This is Taylor. Changing gears just slightly. On Friday, you appointed Chad Pennington to the Marshall Board of Governors, and I was wondering how it felt to be able to appoint someone like that to the board, and if you were considering any other appointees for that board right now. Thank you.
Did Taylor say any other athletes? Is that?
Just any other appointees.
Oh, okay. Well, Taylor, just listen to this. And, my chief of staff said just a minute ago, well, why would you appoint Chad Pennington, or why did you select Chad Pennington? And he said, for God's sakes, he's Chad Pennington. Well, I mean, that's just how I feel. I mean, Chad Pennington is a friend of mine, and I'm very proud to say that. He's an incredible still a very young man. His accomplishments are unbelievable. His love for Marshall University is off the chart. We've tried to get Chad Pennington many times, and very, very, very happy that he agreed. And I think he will absolutely knock it out of the park, from the standpoint of his new position. And I couldn't be happier. You can see that by the look on my face and the tone of my voice. I mean, what an incredible addition, Chad Pennington to our Marshall family that he's always been, but now in a really influential role. And I think we've got some appointments, where we're going to, where people are terming out but can be reappointed and everything. And we still got some additional work to do there. And as those come to me, I'll take them into consideration and we'll keep moving forward. I think Marshall University's got some great days ahead of them. They've got an incredible past, and I thank them for all that they gave me and my family. Kathy and I are both graduates from Marshall, and I got my master's degree on top of that from Marshall. And so, and my daughter Jill, attended Marshall, played basketball for him, and she's a doctor now. So we got a lot to be thankful for about Marshall University, and what an incredible school, and we're just really happy that Chad's there with us.
All right, thank you, Taylor. Next to Bob Aaron with WCHS and Fox 11.
I'm going to go back to the Delta variant for a second, and I'm not sure it was just me here or it may have been the whole system, but Dr. Marsh's answer to the last question, there was no audio for about the last minute or so on that, at least on my end here. We did pretty good over the Memorial Day weekend. Are you anticipating that this will create a surge situation for us after the 4th because it's out there. We didn't seem to have that go on. And will the prevalence of these variants create a need for a booster shot for us somewhere down the road? Because I'm seeing like the Israeli study indicating that while it protects from serious illness and hospitalization, it doesn't seem to be as effective, the Pfizer vaccine, in preventing the spread of these variants.
Bob, let's go back to Clay in just one second, but let me just say this, that, I think I can touch on two of the points of your questions. From the standpoint of will the holiday lead to like how we came through Memorial Day or whatever? Well, we're always concerned about that. That's always a worry. But at the same time, Bob, all we can go by. I mean, how many times have we done just this? All we can go by is the best information that we have. And the best information we have, Bob, tells us just this, that we're in our infancy in West Virginia with the Delta variant. The odds are astronomical that variant is going to go substantially greater than it is today throughout all of our population that's unvaccinated. And from a standpoint of, and I'm going to deviate a little bit from your question and just say just this. Why don't we just have a question and answer session? And just answer me just this question. If you're out there in West Virginia and you're not vaccinated today, what's the downside? What is the downside? Other than maybe just, and I want to be super respectful. It's your right to not be vaccinated. I get that. I get that totally. And I get that some people are just afraid or they misunderstand information or whatever it may be. I get all that, and I am super respectful of all those that say, no, I'm not going to do it. But just answer me just these questions in the question and answer session. What's the downside? What's the risk of taking the vaccine? It's very, very, very minuscule. Do you not believe that if all West Virginians were vaccinated today, do you not believe that it would shut this terrible killer down completely? Do you not believe that less people would die? Just answer my questions. If you haven't been vaccinated, do you not believe that if all of us were vaccinated, if all of our population in West Virginia were vaccinated, would more people die or not? Well, absolutely, the answer is not. Without any question, less people would die. Now, do you not have a responsibility for that? That's another question. If you knew that you're not vaccinated, and all those that weren't vaccinated, if they were vaccinated, less people would die, do you not have a responsibility for those folks that are dying? And some of them, and one of them could be you. And the last thing is, do you not believe that if we had all of our population vaccinated, we wouldn't even be talking about the Delta variant? We would not anyway be concerned about the Delta variant. It would be gone. It would absolutely be gone. We'd shut it down completely. Do you not believe that's a fact? And so when it really boils right down to it, that's the question and answer session we ought to be posing all the time. All the time. And it ought to always start with just this. If all of us were vaccinated, do you not believe less people would die? And if you're not vaccinated, you're part of the problem rather than part of the solution. That's all there is to it. If we had you vaccinated, less people would die. That's all there is to it. It's just that simple, Bob. But Dr. Marsh, conclude with what you were saying in your answer just a second ago because everybody was cut off.
Thank you, Governor. Just to recap briefly, and the governor has really hit the really important highlights, that we know that people that are only partially vaccinated, that means one shot, not two shots of the Pfizer or Moderna, or have been fully vaccinated and haven't been out 2 weeks, after that last shot, then they are still at risk of becoming infected with the Delta variant. But importantly, as we are looking at data from the United Kingdom and Israel, that we're still seeing a very marked reduction in deaths and hospitalizations. We know these vaccines still work great against the Delta variant. It is the people, though, who have not been vaccinated that have the highest risk of being hospitalized and dying and transmitting the virus to other people. So I was saying before that we know, although we've only seen 12 cases in West Virginia, the Delta variant is growing across this country. In the United Kingdom, where they had the variant that is now our most common variant in West Virginia, the Alpha variant or the United Kingdom variant, they now have basically 100% of their cases, new cases, caused by the Delta variant. The Delta variant is more infectious, it's transmitted easier, it is much more severe than the United Kingdom variant, and that's the reason why we are so focused at trying to help all West Virginians choose vaccination, because we know to stop the transmission, as the governor has said, it really requires us to have all people vaccinated, and that's fully vaccinated. When it comes to boosters, the CDC is following data and has been doing this at monthly intervals and still finds substantial effectiveness from the Pfizer and Moderna vaccines, and as working with the manufacturers, and still seeing significant benefit from the Johnson & Johnson vaccine as well. So they're watching carefully. The new variants may mandate some changes to the vaccine in the future, but the good news is currently all the vaccines that are approved for use in the US protect against the most severe consequences of the Delta variant, which is should be reassuring to us all. And it's really, as the governor said, the people that aren't vaccinated that are at really, really significant risk right now.
All right, thank you, Bob. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel and fellow reporters. This is more directed toward General Hoyer. I know there is a little bit of a weakness in the numbers for the younger people in demographics. Are there any regions of the state that are doing worse than average, maybe looking at it from a rural versus urban area of the state type of a question here, General? Can you help me? Thank you.
General, please go.
Yes, sir, Governor. So, Paul, you hit it pretty well with your question. We still see less uptake of the vaccines in our rural areas. We will be starting some additional campaigns going forward that are focused on educating West Virginians on the value of the vaccine and the importance as it relates to what Dr. Marsh has laid out with the Delta variant. So we also are continuing to work within various groups. One of the areas, I was just on a call this morning with folks who run the Healthy Grand Families program. And a good example was a great-grandparent who was raising 3 great-grandchildren who we are working with to get vaccinated. So still a broad spectrum of people that we need to engage, and we'll be working very hard over the next couple of months to get to those numbers.
All right, thank you, Paul. Governor, I'll turn it back to you.
Well, I don't think I've got a whole lot left, that hadn't been already said, but I just want to, reach out one more time to our folks that aren't vaccinated. All of us really hated the mask, did we not? And one way to assure that we'll never see those masks again, ever, 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 is if we were all vaccinated. One way to assure without any question that we'd have less people die over and over and over and over and over, and that amount of body bags that is going to add up and everything, if we don't get vaccinated, it will add up to be really significant. One is terribly significant, but a pile that's higher and higher and higher is really sad. And it's sad because it's driven by the fact that we have folks that are out there, or kids that are out there, that are transmitting this virus around and around and around, and people are dying. You know, so please take heed and listen to our, pleads, to some way, somehow think really, really hard. And we're terribly respectful of your rights and your opinions and everything. And I get it wholeheartedly. But please just take heed to what we're trying to get you to do, because you could be really, really part of the solution and not part of the problem. And I don't mean that in a harsh way, but if we ever have to end up putting our masks back on, it will be simply because we didn't get our people vaccinated like they should be. If we ever have an absolute panic again, it will be because we didn't get vaccinated. Now, with all that being said, I'd again plead with you to some way, somehow, really help us to help people get vaccinated. Whether it be the kids or whether it be our old folks that just haven't done it quite yet, no matter whom it may be, I ask you over and over to please try to help us. You'll be in a drawing for a lot of wonderful prizes, yay, yay. But more importantly than anything, you'll be absolutely part of the solution, and that's what we got to have. Now, the last thing I'd say, and I'd hate to end on something that's not very positive. In fact, this is terribly negative. People ask me, an ABC reporter the other day asked me, he said, well, what's it going to take? What's it going to take for these people that are just dug in and saying, I'm not going to take that vaccine? What's it going to take? And you know what it's going to take? And then you'll come running. Then you'll come running to take that vaccine. What it's going to take is a whole bunch of people to die. If they start dying and they start dying really fast, you'll come running, won't you? Absolutely, and it may be too late. Don't let it be too late. Anyway, thank you so much.